passing the NHI Bill. We speak now to Craig Comrie, CEO of Profmed Medical Aid Scheme. Thank you very much for your time, Craig, this morning. What has stood out for you with the bill?
Good morning, Dudu, and good morning to your viewers. The bill has been passed by Parliament, still has to go through a few phases. One is the National Council of Provinces, and then get signed into law by the President. And we anticipate that that will be done, regardless of the fact that we disagree with some foundational elements that are contained in the bill. And so our disagreements certainly surround the role of medical schemes specifically, the fact that medical schemes are sidelined, and there's certainly an effort to nationalise medical scheme premiums in the form of taxes. We believe that national health insurance, as it's written in the bill, will see one of the greatest exodus of healthcare skills as well. And so we're concerned that the bill needs to make space for private sector funding, and in that way we can retain many of the very short or scarce resources of doctors and specialists and even highly qualified nurses.
And during the consultation phase, because the document also speaks about a number of role players having been consulted, were you consulted, and have your recommendations been inputted in this document?
Well, the question, I guess, around consultation is whether you're willing to change the contents based on some of the very logical submissions that were made. There were 135,000 submissions made to the Health Portfolio Committee. We were represented in Parliament. We shared the concerns. In fact, the National Health Bill through the White and Green papers started in the early 2000s. So we've been very much submitting proposals and commentaries for more than a decade now. So and we are unhappy with the fact that they haven't considered many of the submissions, and the bill in essence hasn't changed for more than a decade. And so I think you have to watch and be aware of the context that the bill's been raised. We are obviously in a political cycle, and so we believe the bill will be adopted, but the implementation is what we would tell people not to be too concerned about at this point in time. We know implementation even highlighted the fact that it might be over decades, and certainly relies on the fact that we have economic growth and a better local economy as well to fund the bill. Our concern would be that the statements about annexing medical scheme premiums can only be done effectively in the way that you raise taxes, and in the current economic situation, many of the taxpayers find themselves in. Any increase in taxes is going to be difficult to absorb.
Craig, this is also being done in the name of addressing the wrongs of the past and making sure that everybody has access to healthcare, quality healthcare. Is that something that, one, you agree with? And number two, if you do, then where is it being done right that maybe then we can learn from there?
Yeah, two very good questions. In fact, access to healthcare is essential, but the way the NHI Bill currently stands, there's a real danger that we have less access to healthcare. And so effectively we agree with the philosophy and the way that the bill's intended to actually address inequities in healthcare. But the details of the bill don't talk about what benefits are going to be provided. There are lots of promises around those benefits. We haven't yet seen proper pricing around the National Health Bill, and most legislative bills come through with a money bill, and so we clearly await how the Finance Ministry actually provides feedback in terms of how we're going to fund this money bill. And I guess what you really need is growth in South Africa to promote people being covered. Universal healthcare coverage is the objective, not really national health. And so we don't see the National Health Bill achieving those universal healthcare coverage objectives. In many other territories or countries, we see specifically the NHSs of the world, as in the UK space, being under significant pressure. And so private healthcare remains an alternative in even those countries, but we see private healthcare becoming more and more expensive. The reverse is that in the public sector, typically what you see is the queues growing and the services diminishing and the infrastructure failing, and that's a response to the increasing healthcare burden that I think globally people are going to have to face and look at into the future. So we still believe that medical schemes have a significant place in terms of the success of a future universal healthcare cover.
Profmed CEO Craig Comrie, thank you very much for your time this morning.